What's one of the biggest expenses most people underestimate in retirement?
Healthcare. And it's not even close.
Studies suggest that a typical couple retiring today might need hundreds of thousands of dollars just to cover healthcare costs throughout retirement.
I'm Jerry with White Oak Planning.
And I'm April. Today we're talking about healthcare costs in retirement, so you can plan ahead and avoid surprises.
Let's start with some context. According to recent estimates, a 65-year-old couple retiring today might need between $250,000 and $300,000 to cover healthcare expenses throughout their retirement.
That includes Medicare premiums, out-of-pocket costs, prescription drugs, and expenses Medicare doesn't cover. And that's for a relatively healthy couple. If you have chronic health conditions, costs could be higher.
Now that's a big number, but it's spread out over 20, 25, or 30 years perhaps. So you're not spending it all at once. But it's still very important to plan for.
At $250,000, $300,000, where is that money going to come from? Most people think Medicare covers everything once you turn 65. It doesn't.
Medicare Part A covers hospital stays. Part B covers doctor visits and outpatient care. But there are deductibles, co-pays, and co-insurance as well.
Medicare does not cover dental, vision, or hearing. It typically doesn't cover long-term care. And prescription drug coverage requires a separate plan, Part D.
Many people buy Medicare supplement plans, also called Medigap, to help cover the gaps. Or they choose Medicare Advantage, which bundles coverage differently. We'll cover Medicare in more detail in a future video, but the key point is Medicare is not free healthcare.
So here's a big issue many people face. What if you retire before 65?
If you retire at 62, you have 3 years until Medicare kicks in. During that time, you'll need to find health insurance on your own.
Your options typically include COBRA from your previous employer, the health insurance marketplace, or a spouse's employer plan if available.
COBRA can be expensive because you're paying the full premium without an employer contribution. Marketplace plans vary widely in cost depending on your income and location.
The point is, if you're planning to retire early, factor in health insurance costs until Medicare starts. For some people, this can be $1,000 to $2,000 per month or more.
One of the biggest potential healthcare costs in retirement is long-term care.
Long-term care includes things like nursing home care, assisted living, or in-home care if you're unable to perform daily activities on your own.
Medicare typically does not cover long-term care. Medicaid can, but only after you've spent down most of your assets.
The cost of long-term care varies by location. But as an example, a private room in a nursing home might cost $8,000 to $10,000 per month or more. Over several years, that adds up quickly.
Some people buy long-term care insurance to help cover these costs. Others plan to self-fund. Either way, it's important to think about how you would pay for care if you were in a situation where you needed it.
So how do you actually plan for all of this?
First, build healthcare costs into your retirement budget. Don't assume Medicare will cover everything. Plan for premiums, out-of-pocket expenses and costs, and other expenses the Medicare doesn't cover.
Second, if you qualify, consider a health savings account or HSA if you're still working and have a high deductible health plan. HSAs offer triple tax benefits, deductible contributions, tax-free growth, and tax-free withdrawals for qualified medical expenses. After age 65, you can use HSA funds to pay Medicare premiums.
Third, think about long-term care. Do you want insurance? Can you self-fund? What's your plan if you need care?
And fourth, if you're retiring before 65, research health insurance options and budget for coverage until Medicare starts.
If you're in a blended family, healthcare planning can be even more complex.
Tell us about it. It has been for us. You might be at different ages with different health conditions and different insurance situations.
One spouse might still be working with employer coverage while the other is on Medicare. Or you might be coordinating coverage from previous marriages or employers.
The key is communicating about your healthcare needs and cost and building them into your overall financial plan. This is another area where working with a financial advisor can help you see the full picture. Here's your action step. Estimate your future healthcare costs and make sure they're included in your retirement plan.
Think about when you'll retire, when Medicare starts, and what the gap looks like. Research what Medicare supplement or Advantage plans cost in your area. Consider whether long-term care insurance makes sense for you.
And if you want help building a comprehensive retirement plan that accounts for healthcare costs, schedule a complimentary Connect call using the link below. I am April with White Oak Planning. If this helped you understand healthcare costs in retirement, subscribe and share it with someone planning for their future.
And I'm Jerry. Healthcare is one of the biggest retirement expenses. Plan for it now so you're not surprised later. We're White Oak Planning, helping blended families build financial clarity and grow stronger together.